Alcohol poisoning is a serious consequence of drinking large amounts of alcohol in a short period of time. Drinking too much too quickly can affect your breathing, heart rate, body temperature, and gag reflex, all of which can potentially lead to a coma and death. According to the Centers for Disease Control and Prevention, men are about 3 times more likely to die from alcohol poisoning, with the most common deaths occurring around the ages of 45 to 54. It is also more common in states such as Utah, Arizona, and Oregon, and least common in states such as Texas, Florida, and Illinois. Most people who die of alcohol poisoning are white non-Hispanic individuals, which is 4.5 times greater than the following group.
Signs of alcohol poisoning include irregular breathing, clammy hands, and pale discoloration, among others. It is important to seek help if any of these symptoms are present. Make sure to stay with the person until appropriate help arrives. Prevent the person from drinking more alcohol, consuming foods, and taking showers. Their health should be taken seriously and should not be ignored. Alcohol poisoning can lead to physical, psychological, and social consequences. Drinking too much alcohol can cause irreparable damage to the liver, as well as increase the risk of cancer of the mouth and stomach. There may be a development of fear towards the possibility of drinking excessively again, and the person might isolate themselves from social settings that serve alcohol.
There are 7 risk factors that increase your chance of alcohol poisoning. Age. Teenagers and young adults are more likely to drink excessively due to peer pressure and their social surroundings. Gender. Like previously stated, men are more likely to drink than women. Body size. An individual's height and weight determines how fast the body absorbs the alcohol. People with smaller bodies may experience the effects of alcohol more quickly than somebody with a larger body. Tolerance. Having a high tolerance for alcohol or drinking quickly by playing drinking games can put you at increased risk for alcohol overdose. Binge drinking. Binge drinking is considered when someone has more than 5 drinks in an hour. Individuals with health conditions such as diabetes have a higher risk of alcohol poisoning as well. And those who use alcohol and drugs may not feel the same effect of alcohol. This may cause an individual to drink more, increasing the risk of an overdose.
Some preventative measures include drinking 1 alcoholic drink per hour, skipping drinking games, picking lower strength drinks, understanding your limit, eating before you drink, resisting chugging, and resisting peer pressure. There are many ways for you to prevent yourself from alcohol poisoning. It's encouraged to keep these things in mind before you start drinking.
If you believe there is an alcohol poisoning, please call 911 and stay with the people until the ambulance arrives. If the people are responsive, try to keep them in a sitting position. Give the people some water if they can drink. If the people are unconscious but still breathe, put them in the recovery position and prevent vomiting. And if there is no breathing or pulse, start CPR immediately until the medical group arrives and be prepared to provide some information. For the medical treatment, patients may receive oxygen and IV fluid to keep them safe and hydrated. For most serious situations, medical group will pump the stomach to flush the alcohol out to save the people, which we call gastric lavage.
CSULB Long Beach established the Alcohol, Tobacco, and Other Drugs program in order to educate students about the negative consequences of drug and alcohol use and/or abuse. To inquire about the program, visit their office location at the Student Health Services Building, room 268. More information about alcohol is also provided on their website, www.csulb.edu/ATOD. The National Institute on Alcohol Abuse and Alcoholism leads a national effort to reduce alcohol-related problems. Visit www.niaaa.nih.gov to learn more information about alcohol.